Good afternoon. Welcome to Grand Rounds. Please remember to sign the attendance record, and also please remember to fill out the program evaluations. And if you could give us any ideas you might have in regards to future topics or future speakers, we would be appreciative. Today we have a timely topic. The NFL season starts tonight, and today we have a review of Sports Medicine 2012. Our speaker is well qualified. Speaker is Dr. Peter Buck. Dr. Buck is an orthopedist. He did his training at the Mayo Clinic, and in addition, he is he's board certified in orthopedic sports medicine. In addition, he is the orthopedic consultant for the men's athletic teams at Iowa State University, and he's here to discuss Sports Medicine 2012. And please welcome Dr. Peter Buck.
Thank you, Steve. Well, we're going to have some fun today. I didn't give you a handout because there's really not much in terms of notes to write on. I do see some student athletic trainers up in the audience, and you may be called upon later to answer some questions. I hope you don't mind. Looks like you're geared up and ready to go. So the topic today is sports medicine, or why you shouldn't pick Peyton Manning for your fantasy team. Well, fall is a great time of year. Let's see if we can make this go, though. My computer has a little, there we go. There we go. Fall is a great time of year. We got 31,000 students here at Iowa State. We got the high school football season up and rolling. We got Coach Rhodes tooling around town in his Harley. College season has started. Marching bands are marching and tooting. And of course, this week, it's all about the big game. And I'm sorry to say that we won't have a sea of red this year at Kinnick Stadium, but we're going to start on the Cy-Hawk series with the big game on Saturday. We'll talk a little bit about that. But first, I have to digress back a year ago when Iowa State, deep underdogs to the vaunted Hawkeyes, won in a thrilling triple overtime with James White tiptoeing into the end zone to stuff the Hawkeyes. So that was a great victory. Now, that being said, I love going down to Kinnick Stadium. This will be the 12th time with the team. I'm heading down to be with Iowa State. It's a great atmosphere for college football. And it's a loud stadium, a lot of energy. What I like about it probably best is the pink locker room. And if you need to make a phone call from the pink locker room, use the pink telephone. And if you go to the bathroom, and I don't have a picture of this, you have to use the pink urinals. So everything's pink there. Okay, so here's what I'm going to talk about today. These are the topics. I'm going to talk about what's new in sports medicine, McFarland Clinic, Mary Greeley, Iowa State, and beyond. I see Dr. Schulman is in attendance, so I may call on him to comment about that as well. Adrian Peterson is the star running back for the Vikings. He had a severe knee injury 8 months ago. He's rehabbing, and if you go to the Twitter sites and the internet, I mean, it's all about Adrian Peterson. Did he have knee swelling today? Did he run? Did he smile? I mean, everything's about Adrian Peterson. We'll talk about his knee injury. I will give my thoughts about Kinesio Tape, Peyton Manning's neck, and then I'm going to talk about kind of some nuts and bolts about the concussion law, although I will not go into details about all that. So first, come fall, orthopedic surgeons scatter hinter and wild just to cover high school football. Gilbert High School is lucky to have Dr. Sneller, who's marching up and down the sidelines for Gilbert High football. And his kids, as they get older and older, I see Dr. Sneller participating more and more in Gilbert High sports. This slide's from the Pinstripe Bowl last, whenever it was, end of December. Dr. Warmy joined Dr. Greenwald and myself for the game. Dr. Greenwald and I, we have been with the Iowa State football team for 20 years each. Dr. Warmy was in his fellowship. Here's Dr. Brian Warmy, fellowship in New York City at the Hospital of Special Surgery, and joined us in the field. Yankee Stadium, what a great place for a bowl game. We had a beautiful day. Team got to dress in the Yankees locker room and got to see pictures of Babe Ruth and quotes, and it was a great, great atmosphere. Dr. Warmy has finished his year of fellowship at the Hospital of Special Surgery and Sports Medicine, so we're eager. He has a lot of youthful energy. We'll bring in some new techniques. Since my last sports medicine update a couple of years ago, Dr. Greenwald and I, we first convinced the American Board of Orthopedic Surgery that we could sit for a subspecialty exam of sports medicine, and then we studied for a year, took the exam, and we are now subspecialty certified as well. So that's kind of what's new in our department. Okay, so what's new with Iowa State sports medicine? I'm going to go through these things, some in more detail than others. The vibration or force plate technology, Normatec compressive devices, the new space age HydroWorks 2000 water rehabilitation pool that's being still not quite ready for us, but almost. Ultrasound unit that we're going to start using in the training room. And I'll also let you know that Iowa State University football provided the face of the new Ken doll. So this is the new facility. I got this picture last weekend. They just taken construction trucks out of the parking lot. This is the new football facility. It opens up into the indoor facility. It's really pretty cool. It's got a 2-story opening into the indoor facility. It's going to be a great place. Of course, the weight room is very luxurious and really tall and impressive because you got to have that to lift heavy weights. One of the interesting things in the training room and strength and conditioning are these vibration plates. And it looks kind of like a little innocuous thing here, but you can set different frequencies. This thing vibrates, and if you get on this, it will send a pulse through your entire body. It's really impressive. If you just do a squat or you would do any type of maneuver on it, your core is really put to a test. And it's very interesting. I think people are still trying to figure out exactly how this works, but it can help if you need a quick warm-up. If you do some just gentle stretching and you're on it, it will warm you up quicker. And it's a fascinating thing. Now, but it is not new. I went back in the annals. This is from the 1850s. This is a vibrating horse at home, and I love that it is a complete cure for obesity, hysteria, and gout. And it prevents stagnation of the liver, and it's inspiriting, and I suspect stimulating. Now, then we moved on to the 1950s with these two slides here with this belt massager where you're going to try to spot reduce with this vibration system. I do like this picture because you can lose unsightly pounds in high heels. And then this is Nate Postma. He's one of the head athletic trainers. He's doing some toe raises on the vibration plate. And it's pretty amazing what a total body workout you get just doing simple toe raises. If you ever have a chance to get on one of these, it's really interesting. Now, these are more attractive than the football players that I tried to model for it, but it just shows someone doing a squat, a dip, some upper extremity work, some stretching on this. And it's something new at Iowa State, and I think I'll just put it this way, it's interesting. Okay, next, Normatec compressive boots. This is kind of a fancy SCD, but I mean, this really wraps up even a great big extremity like in Kevin Garnett. And it's a sequential device. It's not a cold device, but with people in sports, particularly like NBA basketball players, football players, week to week, they get a lot of chronic injuries that barely heal up in time for the next week. So you get a lot of chronic swelling in the knee, then you get downstream swelling. Nothing heals because of the soft tissue thickenings, and this has been very effective at getting rid of those extra fluids and letting the body more efficiently heal. Now, in this new facility, there is this HydroWorks. Now, the old one at the Olson building was a SwimX, which gave a current, and people could exercise in water with a current going through them. This is different. The water is stationary, but there's a treadmill on the bottom. And the thought is that by lowering or raising the height of the water, that this can more accurately simulate running in the athlete. So this is a couple pictures of it. It's a kind of a zero gravity. You can walk into it. And the training staff is very eager to start employing this. But that new facility I showed a slide of is hoping to kind of move into it in October sometime, and I think grand opening will be toward the end of October. This is the old SwimX. It's a great facility, a little different technology, and this is just one of the athletes that had an overnight stay at this fine hotel a couple weeks ago. And then ultrasound, we're still figured out exactly how we can use this, but for soft tissue trauma, and the hope is gaining expertise over time that we can monitor the progress of healing of hamstring, Achilles, and other injuries. We're pretty excited about it, though. And they had a nationwide search. Mattel thought they needed an update for their Ken doll. They thought Ken was a bit outdated. So they had a nationwide search, and none other did Iowa State's Curtis Taylor, right here, former Iowa State defense star, won a nationwide award to be the new face and body of Ken doll. And I'll be honest, I haven't gone to Target this last year to see if it's actually monitored or modeled after Curtis, but a local boy doing well. Okay, usually my old updates have centered on orthopedics and kind of orthopedic surgery and techniques, specific injuries, and so these are some of the topics I've given. Labral injuries, microfracture technique, foot and ankle injuries, a lot on shoulder. And last time I gave an update a couple years ago, the topic was what we can learn from Brett Favre's shoulder, because he had injured every structure in his shoulder, so it gave a very nice topic. But we're going to move on from Brett to his teammate, Adrian. Now, I first had a chance to meet Adrian a few years ago when Iowa State played Oklahoma down in Norman. And at that point, Adrian Peterson was a fabulous running back. He was head and shoulders the Heisman Trophy winner. Hands down, he was going to win this. Well, Oklahoma still had Adrian Peterson playing in the fourth quarter with a three touchdown lead. And this is how I got to know Adrian, because Adrian's going to take the ball here. And this is kind of interesting because he's pretty fast. So the quarterback's going to hand him the ball. He's going to go around the left end. And then he's going to make a cutback. And right about here, you'll notice 23 is in a great position to make a tackle. He's going to bring Adrian Peterson down. He's got the angle. But instead, he tackles nothing but air. And then we have number 6 here, who also had an angle to get Adrian Peterson. But look at his effort of trying to bring Adrian Peterson down. Not there. And then Adrian Peterson dives into the end zone, lands right on his left shoulder. Well, that's how I got to meet Adrian Peterson, because after the game, I took one of the Iowa State players into the locker room to get x-rays of his ankle, and there's Adrian Peterson getting his x-rays of his collarbone, shattered clavicle, out for the season, Heisman Trophy down the drain. So that's how I met Adrian Peterson a few years ago. Now we'll talk about what's going on with Adrian now. He had a knee injury last December, and it comes kind of quick, but you're going to see a person from the right hand kind of hit his left knee as his foot goes down here. And just in case you missed it there, we're going to watch it 2 more times. So here it is, left foot going down, bingo. Knees don't like to go that way. And then we're going to see another view of this from the other angle, from behind. And unfortunately, right when his foot plants, in fact, the contact is even made a millisecond before the foot plants, so that when the foot actually hits down, the force is very specifically focused to his left knee. Bingo. And that hurt. So what structures did Adrian Peterson injure? Well, because he took the big blow from the side, he wiped out his medial collateral ligament here, and he ruptured his anterior cruciate ligament. So 2 ligament injury. This is what a torn ACL looks like, and in previous talks we've seen videos and things of the reconstruction, but it looks like a bomb goes off in there. On MRI scan, this is the normal ACL, here's a torn ACL, and this white material here is a hemarthrosis in the knee. So Adrian injured both his ACL and MCL. Now for reconstruction, we either use patellar tendon or hamstring tendons. If it's patellar tendon, we take a central third of the patellar tendon and a little bit of the patella, and tibia tuberosa is our graft. If it's hamstrings, we use 2 of the hamstrings coming through here. We lift up the sartorius, we find the gracilis and semitendinosus, and harvest those 2 as a graft, put them in the knee joint, give it lots of time, because you put the graft in there, but you've taken it out of the body, shaped it like an ACL, put it back in, blood vessels have to grow into it. So Adrian, the surgery was essentially the first of the year, so he's 8 full months getting back to it. But I love reading the reports. I mean, he had swelling today, he didn't have swelling today, blah, blah, blah. He didn't go through he played none in the exhibition game. He'll play tomorrow night in their home opener. I think it's against the Jaguars, and we'll see if he's playing. But if you picked him for your fantasy team, I think you'll be sorely mistaken. I mean, it takes with a major injury like this, it takes 2 years for an athlete to get back to superstar form if he's going to. They get back, and Adrian will be a pretty average running back this year. Average, is good, but he won't be Adrian Peterson. So look to see if he enters the game or when he enters the game tomorrow night. Okay, I'm going to give kind of my philosophies about Kinesio Tape. So it's very popular. If you watch the Olympics at all, you saw that many, many, many athletes use Kinesio Tape this year. It was developed actually 3 decades ago by a Japanese chiropractor, Kenzo Kazi, and now 4 years ago at Beijing became popular, and now it's kind of the rage. So there's different places and different ways you can apply Kinesio Tape to different body parts. We saw it a lot with the divers. With the Jamaican runners, they use their country's colors, and very popular with the beach volleyball. But for those non-initiates, this pink tape here is Kinesio Tape, and this blue band here is not. So kinesio would imply that it's a tape that allows for full range of motion of the joint. What does it do? Well, first of all, I'll tell you what Kinesio says it does, and then we'll talk about what it does. But it says it pulls the skin away from the deep fascia and increases circulation, reduces pain and inflammation, relaxes overused tired muscles, supports muscles. They report that it is exactly 140% elastic, heat activated, and durable. They say that both the tape itself and the taping technique is equally important. You should put it on 1 hour before competition, and then you need to rub it down to activate it. I really do kind of like this slide. They say that kinesio taping works by lifting the skin microscopically, which forms convolutions creating an interstitial space, and that helps to restore the fascia natural linear pattern, which in turn increases range of motion. Well, that's kind of mumbo jumbo to me, but anyway, so this is what the manufacturers. So there have been some studies that have been done of Kinesio Tape. Now, there is no study that has actually been able to effectively study sports performance in Kinesio Tape. As you can imagine, that'd be hard to do. But actually, there is a study that's compared this tape to other modalities, and it's found that Kinesio Tape is, if you have a sore shoulder, one that does not have a torn rotator cuff, it will actually make it feel better. That after ACL surgery, if you apply it correctly on the quad muscles, that you can better activate the vastus medialis. And with one study showed that in post-stroke patients that it helped out with restoring their sense of proprioception. So it's not all bogus. I think in sports, though, there's a huge placebo effect. If the athlete thinks it's going to enhance performance, it's going to enhance performance. I did like some correspondence from London, though. One person called it a fashion accessory, but my favorite was war paint. So, they put this on, they look tougher and meaner, and they are going to go out. But the bottom line is it's not likely to harm. So here's some example of what I call war paint in the Olympics with track and field and some more beach volleyball. But one thing, this next picture brings it out, that Kinesio Tape does not automatically make you more focused and attentive. Okay, so this is how we saw Peyton Manning a year ago. He's standing on the sidelines. Here's a Hall of Fame football player not contributing to the Indianapolis Colts. The Colts have a miserable season. They have one of the worst seasons ever in pro football, so bad they get the lottery choice, so they recruit or they pick a top quarterback, and then Peyton gets bounced. So I don't know where the justice is in that. But anyway, Peyton's gone, 18 for the Colts, now he's 18 for the Broncos, and he has been playing fairly well in exhibition. Now, he has had neck surgery. This is an example of an anterior neck fusion, and we're going to get back to that neck. And actually, Peyton's had 4 operations that have been conducted in state-of-the-art facilities. Now, here's what's interesting. The studies have shown that, and we've had experience with at least three athletes here at Iowa State, Dr. Schulman might correct me on this, that have had temporary paralysis. They've not necessarily needed neck surgery, but in those that have had structural problems, This paper reviewed people that had an effective fusion, and these 5 people were able to get back to a high level of football activity. So that's one study. Here's another one, outcomes following non-operative versus operative treatment in cervical disc herniations in the NFL. And they found overall about 100 athletes, they divided up into non-operative and operative, and the people that had surgery and successful fusion had a much higher incidence of getting back playing NFL football. So my first thought about Peyton was that there would be no chance in heck that he'd be playing this year, but we'll talk about that. So he's had 3 that I could document operations. I talked to the spine surgeon for the Dallas Cowboys who is in the know. He told me some of the details of Peyton, although he was not the surgeon, but he could not give me details of the 4th operation. One was a foraminotomy, so that's a limited procedure where you go in and clear out space around the nerve as it exits, because Peyton has a weak tricep, so it's hard for him to throw the football. Then he had a discectomy from the backside. Those didn't work, so he went on and had an anterior fusion like I showed in that slide. And the Dallas Cowboys spine guru says that that's the surgery. If you want to play in the NFL, that's what you have to have. But Peyton still has some weakness in his arm. Apparently he can throw the ball about 40 yards, whereas he used to be able to throw it about 80 yards. He is 36 years old. Sheesh. And, but he does have Hall of Fame talent. So, but here's what's good about Peyton. All the surgeries have been done on one level. He's not, I thought heading into this talk he'd had surgeries at multiple levels in his neck, and those people do not return to football. But he's only had one level. He has a solid fusion, and he doesn't play defensive back or running back, which would really be the high-risk position for playing. Now, that being said, I think he is one hard sack away from retirement, though. I think this year he's going to have games of brilliance and games of mediocrity, and he's going to have average stats. And if he can get through this season, I expect that he'll have a great final season in Denver next year. Now, that's what I say, but I opened up my Sports Illustrated last night. Sports Illustrated has Peyton Manning and the Broncos going to the Super Bowl this year. So it shows how much I know. Okay, early in August, we had our yearly screening of Ames High School football players. This is the 2nd year now. This is about 7 a.m., August 1st or something. And all the football players were there because it was their media day for their pictures, so they were a captured audience. And so we could do baseline neurologic and cognitive screening. So Erin, my trusty nurse, and Heather from our department, Dr. Foster Wendell, and some other pediatricians, some athletic trainers, and physical therapists, collective big group, we did baseline testing of every football player at Iowa State. And they've done this 10 years at Iowa State, Mark? 12 years? How long? Long time. Yeah, long time doing baseline screening. So we have baseline tests for all the athletes, and then if they have a concussion or suspected concussion, or they're trying to get through the concussion effects, we can redo the same test and see how their cognition is. And it's pretty interesting because every athlete has strengths and weaknesses. Some can, you give them a six-digit number and they can repeat it backwards easy. The next person can not do that. The one person cannot do months backwards. Some people can't recall 3 objects you give to them to repeat back to you. Others can do beautifully. Everyone's different. I'm part of a committee, the Iowa Medical Society Committee for Sports Medicine, that has been setting up guidelines for concussion actually for several years, because it's been apparent that concussions are a big problem in high school sports. So a few years ago, we gave some guidelines to the schools. Then a year and a half ago, the Iowa legislature passed a law. So this is a guideline. It's not, I mean, this is a law. It's not a guideline. But what it says, and I'll just highlight, if a student or coach or contest official observes signs, symptoms, or behaviors consistent with a concussion or brain injury in extracurricular activity, the student shall be immediately removed. And I mean, I should say this is Iowa Code Section 280.130. And they cannot return until they have been evaluated and cleared by a licensed health provider. So if someone is suspected of a concussion, they don't get back into the contest. I don't care if it's a head bonk as a cheerleader or a volleyball player or a football player, they don't get back in. they're observed for any signs of concussion, headache, irritability, dizziness, things like that. They have to see a practitioner, get through the symptom portion of concussions, then they have to be cleared, then they start with light aerobic activity and then move upward through activity in stepwise fashion, then get back to play, which even in the most minor concussion would take a week and obviously can take a long time, much longer time than that. But the bottom line is concussions in high school kids, junior high kids are serious. And if they have a second concussion, that can be catastrophic. And so the awareness of concussions, I think, is a huge thing. And of course, that's trickled into college and then in the NFL. So, I mean, this whole concept of brain injuries, repetitive brain injuries, long-term effects from it are going to be, the studies are just going to come out of the woodwork in the next 5 years as to how serious this is. So there's cards that list the symptoms of concussions. Every parent of any sport has to read this piece of paper at Ames High and throughout the state, because this is what our committee developed, this form here. The parent has to read it, sign it, and return that before their kid can play. Now, the tests that we did involve orientation, memory, concentration, balance tests, coordination, and recall in a standardized fashion. And it's been shown with numerous tests that there is validity of their baseline tests and then tests if they have a head injury and as they're going through it. So I think it's a great thing. It doesn't prevent injuries. What we're really trying to prevent is the second injury, which can be so much more severe than the initial concussion. So I'm going to wrap things up. My conclusions are, this is a big game. I hope the Cyclone-Hawkeye game is great. It's going to be cooler this weekend, perfect football weather, and I hope both teams play well. As I prepared this talk, I had some preconceived notion. I thought that Peyton Manning should never play football. I thought the Kinesio Tape was absolutely bogus, but I think Peyton, he loves to play football. He's had one-level disease. He has a solid fusion. We'll see what he can do. Kinesio Tape may have a role medically. So I've had to give up some preconceived notions. I think that concussion concerns are going to shape football over the next 5 or 10 years. I think we already see it this year. There's a difference of where people kick off. Many more kickoffs are going to go in the end zone, which means fewer returns, which means, because that's a high-risk activity, I think we're going to see lots of rule changes along those lines. I'd love to say that we'll have some difference in helmet design that would actually protect the football player better. Those are a stretch right now because there's just so much we don't know about concussions. One person can sustain tremendous blow to the head, not get a concussion. The next person can get a relatively low blow and get a concussion. We just don't know. But I think that things in football are going to change radically over the next 5 to 10 years. And that's it. Thank you. All sports, cheerleading, and I don't think marching band though. No, I mean I see injuries from marching band. I'm not making fun of that. Yes. I can't hear you. Sorry. I'll let you go ahead and grab that microphone, please.
Sorry. So I think that Kobe Bryant was getting injections in his knee in Germany. What are they injecting there that we don't have here?
I'll be honest, I don't know. Sorry. Something really great and probably really expensive. Any other questions? Dr. Schulman?
The rumor is he not only played with rich plasma, but the PRP that people have talked about for the last couple of years, which is still kind of controversial in literature, but there's one guy in Germany now who is heating it first to super activate it. And that's that's what athletes have been going to Germany for this one clinic that is using a super activated spun plasma.
Okay, thank you. Any other questions?
Pete, when do you actually use that baseline that you establish?
Well, we use it 2 times. One is if at least at Iowa State, this is used if a if a football player has an injury on the field during the game, that athlete will be retested during the contest to see what his, they'll let 10 or 15 minutes pass and then they'll test, see how it compares to his baseline testing. So that's one way. And then if it's deemed they have a concussion, they'll be used, because there'll be deficits in how they score on it, and then they'll use it in the recovery period to see how he's getting back to baseline. Correct. Yes.
Dr. Buck, could you comment on female soccer players and concussion injuries and whether there's any movement in Iowa towards recreational laws regulating concussion and concussion recovery?
Well, soccer is a very controversial sport right now because of all the collisions, but then all the headers, which they've measured how much impact a head gets with heading a volleyball or heading a soccer ball, and it's pretty high. I am unaware of any rule change type things, but it's just another sport that we will be concerned about the long-term effects of repetitive brain injuries.
We have this set up for high school and junior high, the law, but there's a lot of recreational sports that are occurring, and I think the question was more, she asked about women, but sports that are occurring currently, how are those being governed, or do you have a good idea about how it's being done?
Well, I'm glad you asked. I'm glad we have a neurology specialist in our audience, so that's great because you may have some better comments about concussions. But there's really no monitoring. I mean, and as far as I know, there's no control over that. I think what it's going to be, though, is that the awareness of the concussion problem is really going to rise from the grassroots now, and I think everyone is more aware of it now, and it's going to become even more. It used to be kind of a thing of honor that you'd ding yourself in a recreational whatever event and you'd get back into the game. Well, I mean, I think that philosophy is changing and will change, but there's no way of monitoring recreational sports. Do you have any comments about the concussion law or return to sports? Oh, there's
no. That's the dark side is that it's a progressive condition. I mean, the ding to the head, if it's done properly, can establish a pathology in the brain that's progressive, and that's what you see after 8,000 hits to your head, which happens with our high school and collegiate players. The thing that's strange is the thing you pointed out, Peter, early, which is it's very idiosyncratic. I mean, some people can, for whatever reason, their brains are able to tolerate this type of shock, and maybe it has to do with the volumetrics of their head. But you can also look at a NASCAR, which they have their heads just locked into the car, and they withstand horrendous blows and decelerations, and they don't have any concussive type problems. So there's a lot of things to think about in that whole issue, but I'm glad you brought it up, and it's a huge issue, and it does have a real pathology that has real consequences that we know about. So,
thanks, Sal.
Issue.
The other thing, Pete, is it's not so much necessarily how hard you get hit in the head. It's the resultant backlash or the whiplash of your head going forward and then coming back, where the brain inside is really just floating, and now it's floating, but it's being thrown forward as the head is coming back in a rebound. So it's a counter-coup type injury that makes it so bad. And it doesn't appear necessarily to be a super hard hit. It's more the whiplash problem that you get from it.
So it just makes it even harder to know how to monitor things. Yeah. Dr. Hallberg, do you have a question?
Any objective evidence for vibration rates?
Well, I'm glad you asked that because we have 1, 2, 3, 4, 5, 6 student trainers up there. The question is there scientific validity for any benefits of the vibration plate? So I'm going to pose it to the spokesman for the student trainers as is whether or not there is any scientific validity to the vibration plate.
I guess just in our studies, we haven't seen anything, or at least we haven't heard anything. But I just know that our strength staff with UNC McKnight, they're really pushing them for stretching, and even they started using foam rollers while on the power plates as well. And so I know with a lot of our kickers and punters who are having groin, strains and hamstring strains, a lot of them are starting to use them, and we've seen positive results, but I guess scientifically, I'm not quite sure.
So we'll await these scientific studies. All right, thank you.